The information provided on this video is for educational resources only. It is not intended to serve as a recommendation for the treatment or management of any medical condition. As with any new exercise program, it is advised to consult with your healthcare provider prior to performing these activities. These exercises should be performed with no pain. If you experience any pain or discomfort, stop immediately and seek attention from your healthcare provider. During pregnancy, you may experience pain when you move from sitting to standing, rolling in bed, or getting in and out of a car. In this video, you'll be shown how to use your abdominal muscles and your pelvic floor muscles to help support your pelvis as you move throughout your day. The transverse abdominal muscle is the deepest layer of your abdominal muscle group and acts like a corset to provide stability to your spine and pelvis. It attaches from the sternum ribs to the pelvis and spine. When you contract this muscle, it should feel as if your lower abdomen is tightening, as if you're trying to button jeans that are too tight. So when we're performing this, I will have you start with an inhale. As you exhale, draw that belly button towards your spine, allowing for a tightening and a lift of the lower belly. To tell if you are doing this correctly, place your hands on your hip bones and feel the muscles tighten under your fingers. So inhale, exhale, and tighten. If you feel like you're flexing forward or your rib cage is bulging to the sides, you're giving me a little bit too much activation. This tightening should be about 30 to 50%. You should still be able to move. You can perform this contraction along with all of your exercises and movements. The other component to a good pelvic support is using your pelvic floor muscles, otherwise known as a Kegel. When you're doing a Kegel, what I'd like you to do is inhale. On the exhale, I want you to tighten or squeeze as if you're trying to stop the flow of urine or trying to stop passing gas. You shouldn't be able to tell that you're doing a Kegel from outside observation, so there should be a gentle lift between your anal opening and your vaginal opening. I want you to squeeze and hold on the exhale for 3 seconds. So women during pregnancy will report that they have pain when they're moving from one side to the other in bed. To help alleviate some of those symptoms as you're sleeping, you should engage that transverse abdominal muscle that we just learned how to activate. Keep your knees together as you keep your spine aligned and turn from one side to the other, keeping that stomach engaged and tightened. Breathe through the process and keep those knees together. Also, a common complaint is pain when you're moving from lying down to sitting. So the use of that TA, you'll tighten that muscle. Use your hands to help push you up as you drop your legs down, making sure to breathe throughout the process. When sitting, it is important to sit with hips and knees at 90-degree angles with feet supported on the floor. So your pelvis should be in neutral, not tilting forward, not tilting backwards, and your knees should be at a right angle. You should feel even weight bearing through your sit bones or the bony prominences you feel against the chair. And you shouldn't try to lean to one side or the other. Crossing your legs can increase strain on the muscles in your back and hips. If you need support, you can use a towel roll or a lumbar support and place it on your lower back, allowing for that curvature and relaxation of those muscles. When you move from sitting to standing, place weight evenly through your legs to improve stability in your pelvis. You should engage that transverse abdominal muscle and a Kegel at the same time, exhaling as you stand up, maintaining that contraction until you're fully standing. When you're going from standing to sitting, engage that transverse abdominal muscle and the pelvic floor muscles as you sit back down, placing the weight evenly through your legs. If you're needing to stand throughout your day, it's important to look at your posture. You would like to try to evenly disperse your weight between your legs and feet, looking at your toes, making sure they're pointed forward and not out to the side. Feeling the weight in your heels versus your toes. You move up from your feet, looking at your knees, making sure they're soft and not locked out. We go up to your hips and your pelvis. It's common that during pregnancy, the weight of your belly is pulling you forward. Notice, is your bottom sticking out? Can you try to decrease the strain on your low back by tucking in your buttocks a little bit, still allowing for a curvature, but decreasing some of that forward pull? Looking at your shoulders, are they rounded forward, or are you able to bring them back into neutral position away from your ears? And your head, is your head sticking forward, or are you able to keep it in a nice neutral position aligned with your spine? This can take some getting used to. It's awkward in the beginning for people to change their posture, but this will allow for improved support throughout your body. When walking, it is common to hear about the pregnancy waddle when you shift from side to side, which can increase the strain on your pelvis and your muscles. Try to decrease the amount of sway from side to side by starting with your toes pointing forward and shifting the weight from your heels and pushing off into your toes. As you're walking, make sure to engage your buttocks with every step, allowing for that extra support. So most people, when they get in and out of their car, they bring one leg in at a time and then sit down, bringing the other leg in. This can cause increased pain through the pelvis. And there's a better way that you can get in and out of the car with even weight bearing and use of your abdominal muscles. So when you're going to sit into the car, I would like you to engage your belly, engage the pelvic floor, and sit down first. Bringing both legs in after you've sat, still using those abdominal muscles. When you're getting out of the car, again, bring both legs out, and then engage the belly and the pelvic floor muscles as you stand up. If you need support, you can put your hand on the seat and push yourself up as well.